the numbers really suggest a solution. By the time we pay for four-vessel bypass, I mentioned, we pay $250,000 to the surgeon, the anesthesia, the recovery room, etc. Well, if in say a 10-year period, that man does not have a heart attack, or doesn't need a bypass, we're sitting on that $10,000, that $250,000. We'll happily give $10,000 to the doctor for keeping his patient healthy. We'll give $10,000 to the patient for staying healthy, $10,000 to the clinic. We're still sitting on $200,000 profit. There's profit in keeping people healthy. There's value to the community. For every CEO that doesn't go down with a heart attack, that's worth something. For every young breadwinner that doesn't develop a colon cancer, that's worth something. And the money is in the system. We need to, the bean counters need to change how the beans are flowing to reward the people for staying healthy. It's called value-based compensation because there's value to the community. And that's what really needs to happen.